So, Dr. Mansell, let's first of all thank you for joining us for Eye on the Issues and talking about what's happening in Wyoming right now. Of course, we're talking about Medicaid expansion, HB 80. And I know it doesn't look promising it's going to go through, but let's discuss what it is and how you feel about it. Let's begin. What does the bill call for?
The bill calls for coverage for what proponents estimate is an additional 19,000 people in Wyoming who currently can't afford health care insurance premiums. And of course, health care is so expensive, they can't afford paying for it out of pocket either. It takes advantage of an offering from the federal government for funding that would theoretically cover 90% of the estimated number of covered lives. And if you combine that with one of the ARPA fund offerings of, I think it's $54 million, the $22 million that the state would pay as their part would actually trigger that additional money. So they feel like they come ahead $32 million for covering these 19,000 people, which of course is an attractive offer.
Now, you say there's no volume to this. Can you explain that?
So in other states that have expanded Medicaid, the estimates of newly covered lives have all been off. No one's accurately predicted it, and the numbers have been off by 200 to 300%, which is why I testified in front of the committee down in Cheyenne that I think we're going to be more likely to see 60,000 people. And there are several contributing factors for this. Firstly, Representative Baer asked the head of the Department of Public Health for Wyoming, did the model that they use account for the people who are coming across the southern border, that we have absolutely no estimates of how many are coming. And gracious as he was, he had to admit that no, it didn't. Another factor that we're seeing in Wyoming at the clinical level, because I see patients every day, I'm not a talking head as much as I'm just a practicing physician, is people who have fled from other parts of the country because the cost of living has gotten so high. So for example, on a daily basis, I'll see people either from the West Coast or the Northeast Corridor who moved here, and usually to be sociable, I say, what brings you to Wyoming? And they'll say, well, I can't afford to live where I was before. And on top of that, these other areas usually have expanded Medicaid. And so another draw to the state of Wyoming is that the healthcare infrastructure where they left has been exhausted. It's been saturated. And so their wait times to get in to see a provider, to get into the emergency room, are so off the charts that it's not really effective healthcare for them. If they have to wait 6 months to get to see someone to manage their hypertension, for example, that obviously is not fast enough.
And let's talk about who actually would be eligible for this Medicare expansion if it did go through.
So the way the program is designed, it's anyone who makes below 138% of the federal poverty level. And that includes some fairly fancy calculations to include the cost of a family. And I'm not going to tell you I'm in the weeds that far to be able to quote those numbers to you. Obviously, it sounds very noble. So those of us in healthcare absolutely want to improve access. So when we have to testify against a program like Medicaid expansion, we have to be very careful that we are explaining the reason we're against the program is not that we're against people having access to program. It's against the fact that the policy has not actually been shown to be effective to improve access to the program. One example is if you expand access to coverage with Medicaid, but Medicaid doesn't cover the cost of the care, there's not enough resources in reimbursement to expand the number of clinics, to expand the number of providers, or to expand coverage within a hospital to actually take care of these people. It's almost like giving someone a coupon for something that doesn't exist.
Let's talk about medical care in Wyoming in general for a quick second here. Lots of states, especially states out west, in New Mexico, for example, being one of them, are so they just have nowhere near the number of doctors to care for the people out there. Is that a factor at all in Wyoming? Tell me about that.
Nationally, we have a shortage of providers, no doubt about it. The thing to recognize, though, is this isn't a situation that just sprang out of nothingness yesterday. This is a consequence of the Omnibus Act of 1986, when Congress passed a law that started cranking down on reimbursement from Medicare and Medicaid. What's interesting about that, for my specialty, my core specialty is anesthesiology, is in 1986, we had 135 credentialed anesthesia training programs within the United States. But because Medicare and subsequently Medicaid cranked down the reimbursement every year for almost 9 consecutive years. By 1993, we only had 100 first-year residents left in the United States for the entire specialty of anesthesia. And the reason is the medical students were paying attention. You know, they saw that all the hospital-based specialties, radiology, anesthesia, pathology, and ER medicine, were having their rates cut. And one of the reasons that the government could be so bold in doing that is because these are all hospital-based specialties. And so they turned to the American Hospital Association and said, you better lock their contracts so they have to see Medicare. And so all of these hospital-based specialties were basically hostage to the rules the hospital set in their contracts.
Very interesting. Let's talk for a second about other states that have gone ahead with Medicaid expansion. Can you compare and contrast any other states that you've investigated?
Well, one recent number that we saw either last year or the year before last is when Ohio expanded Medicaid. At last count, I haven't seen the most recent number of their state budget, but their state budget was up to 38% of Medicaid spending. Their entire state budget was 38% Medicaid spending. And obviously, they had to come out of something else. So it came out of their transportation department, it came out of their education budget, it came out of law enforcement, because unlike the federal government, Ohio, and neither can Wyoming, we can't print money. So we basically have to make resource allocation decisions if we do have a program that's costing more. The other problem with Medicaid expansion is there's no volume knob on it. It's like buying a stereo that only goes at the volume it wants to. For that reason, what we see is in states like Ohio, the budget is sort of a runaway train because they're codified and tied to this particular budget. They can't do anything about it. Now, there is one exception to that. They can reduce the reimbursement level for each service that's provided. And so that has happened in states like New Jersey and California, where right now, if you're an anesthesiologist doing a heart transplant, you're making $23 an hour after you pay your malpractice and the cost of billing. Obviously, that's not sustainable either. So the other sort of canard that they tell in committee is they'll say, well, look how well it worked in Montana, but they always manage to forget the Montana Hospital Association's report the first year after Medicaid expansion in that state, where their average state hospital profit margin dropped 40% within the first calendar year.
Wow. All right, let's talk for a second, if we can. Are there any other bills that are going through the legislature now that you're very passionate about, like this one?
I don't track legislation that closely since I told you I'm primarily a physician.
Sure.
So no, I really can't give you a great story of a bill that I'd love to see go through at this point in time.
Okay, there are two other things I wanted to ask you about, two other measures. One of them being, do you have any thoughts on medical marijuana and the possible legalization of that? It doesn't seem like it's going to happen in Wyoming soon, but at some point it could. Do you have, as a doctor, do you have any thoughts?
Well, I mean, we already have alcohol, and we already have gambling, and we already have the new alien invader we call smartphones, none of which seem to improve our productivity, and all seem to have some addictive quality to them. I'm not sure we need to add a fourth big category to that. It appears that in states that have legalized it, like Colorado, their auto insurance rates have gone up, and their need for additional social services spending has gone up. So for me, it's hard to make a social argument for it. As far as medical argument is concerned, there was a international meeting of psychiatrists in Scandinavia last year before last, where they made a public statement that they felt that the majority of adult onset schizophrenia was due to marijuana use. So that doesn't seem like a very endorsing fact about marijuana either.
Last question. What do you like most about living in Wyoming?
Well, the people. I mean, this is a great state with self-sufficient people. When I was in the Army for 23 years as a reservist, National Guard, Army Guard, and then I was also federalized for about 6 years. In my last few years, I was an Army flight surgeon. And the joke about pilots in any military branch, Army or Air Force or Navy, is they won't come in to see the doctor unless there's like a piece of rebar sticking through them because they want to keep flying. And people in Wyoming are very similar to that. They basically come to see you, and the most common line from them is, you got to get me right, you got to fix me so I can work overtime. So sort of the resiliency and determination of the average Wyoming citizen is really just, it's a great place to live.
All right, Doc, we appreciate your time.
Thank you.
Thank you.